A 2-month-old baby died due to human error in medication. This unfortunate incident took place in New Zealand, and ever since it has happened, it has sent shockwaves across pharmacy bodies and industry. Today, we are trying to build a solution oriented discussion around this so that we can understand that at first place why such incident happen and how better we can avoid them, what steps one should take. And to make this conversation insightful, we have invited Elite Expertise Managing Director and practicing clinical pharmacist based in Australia, Mr. Arif Mohammed sir.
Thank you, sir. Thank you joining us for this insightful discussion. Sir, there is an unfortunate incident that has taken place in New Zealand. I know you might be aware about it. That 2-month-old newborn died to wrong medication and some human errors. I know it's very unfortunate, but to understand the depth of this situation, as a pharmacist, I would like to know how such situation can take place, and from our end, what precautions we can take, how such situations can be avoided.
Yeah, sure. Thanks, Ashutosh. And first of all, I'm so sorry for this news that we recently came up that on 19th of August, so there was an incident that happened in one of the hospitals in New Zealand that a 2-month-old baby has received an overdose of the medication. First of all, I would like to extend my heartfelt condolences to the family members. And here, I'm not going to talk about like what exactly happened in that particular scenario because I wasn't there within that picture. So I can't predict anything by myself and I can't keep on giving any judgments. But what I can share with you is like how the incidences will occur. Okay. The common errors that happened. So it is a case of a medication error, medication error that happened while dispensing the medication in the pharmacy. And I would like to share that why these medication errors they occur and how things that happen, and at what levels that the medication errors that happen and how we can prevent or avoid this type of the medication errors. So first thing is a medication error, it can occur at any stage, like by the time when the doctor, they are prescribing the medication. So they might prescribe a wrong dose. Like instead of mentioning sometimes like 15 micrograms, they might write it as 15 milligram. So which is a higher dose. Okay? So this type of errors that happened like many times all over the world while the doctors, they were prescribing. And even when the pharmacists, they are dispensing, sometimes they might dispense a wrong medication and the dose might be incorrect. And even when in the hospitals, I'm talking about when the nurses, they give the medication to the patient, sometimes they might give a wrong dose or the wrong medication to the patient. So all these are the different stages where the errors might happen. But as being a healthcare professionals, so we must take the responsibility and to make sure that at each stage, there should be a cross check or a double check should be done. So before that medication is released or before that medication is to be sent to the next level, or before the medication is administered to the patient. So this is the main aim there to avoid this type of the errors. So here I can categorize that the errors can be of like two types. One is the minor errors and the major errors. So some minor errors, we are not much concerned about it. Like even the minor errors, like we have to prevent and try to avoid them. But if such minor errors, if they happen, there is no much harm that occurs to the patient. But there are some major errors that might lead to cause even some serious consequences, that what we have seen, noticed just recently, this incident. So these errors are more common with high-risk medications. So in pharmacy, like we have the high-risk drugs, high-risk medications. So there are certain medications where we categorize or we tell them as at a high risk. So, for example, like if you take the methotrexate or methadone and other opioids and some anticoagulant medications, that is the blood thinners like warfarin and other things, lithium. So there is a huge list of the high risk medications. So whenever the doctors they are prescribing these high risk medications, the doctors should make sure that they are prescribing the correct dose and everything is appropriate. And even whenever the pharmacists they are dispensing these high risk medications, always the pharmacists they should never rush to do the dispensing, and they should never rush to finish the dispensing and give it to the patient. Okay, so the pharmacist should take their own time. Okay, and they have to double check, they have to cross check in case if the dose is correct and the dosage frequency that is mentioned is appropriate, and whatever the things like the patient's weight and everything, that we have to make sure that everything is appropriate. Then only we have to dispense and hand over that medication. And even by the time when we hand over that medication, so a pharmacist must make sure that a proper counseling is to be done to the patient to avoid such type of the errors. Okay, so these are the few things that I'm not going much in detail, but an overview that I'm letting you know, that these are the stages where we can avoid the medication errors. Okay, and the main thing here is about the workforce as well. So when it comes to the, especially I'm focusing about the pharmacy workforce. So when it comes to some busy pharmacies where they keep on doing a lot of prescriptions, dispensing a lot of prescriptions, or even in the hospitals where the hospital inpatient pharmacy services, they keep on delivering a lot of inpatient medications to the patients. So they're at such busy places, so always we must make sure that sufficient staff should be placed. Okay, and like instead of placing one pharmacist in a busy pharmacy, at least there should be 2 or 3 pharmacists, so that the workload will be much less and they can avoid such type of occurring such type of the errors. So that at least if one pharmacist might have missed out, and then the other pharmacist might catch it, and they might prevent occurrence of the harms.
Very insightfully, you have defined that what are the responsibilities of a pharmacist and how they should be cautious about what they are prescribing. But other than that, so there should be some amount of caution from the relatives of the patient as well. And you being a clinical pharmacist, you have many years of experience dispensing medication and helping others to how to take this medication. So do you have any insight from your past experiences that you would like to share, that some things happened and you prevented that? How such things turned out?
So here, one thing, like as you are asking about the parents' perspective or the carers' perspective, like how they have to administer the medications and so on. Okay, so here I'm not going to discuss about that parents' perspective or the carers' perspective. So because if as a pharmacist, as a healthcare professional, if we might have provided them the appropriate counseling, okay, and explain them that the correct way how to use the medication, okay, then we assume that the carers or the parents they follow the same instructions. Okay, so in case if even though after giving an appropriate counseling and providing all the information, if some sort of the error has occurred, okay, then that's completely a different scenario. Okay, so where the parents might not be aware that what exact dose is to be given and so on. But sometimes the problems, like here I'm mainly discussing about the errors, that which is nothing but the medication errors that occurs while the doctors they are prescribing, or the pharmacists when they are dispensing, okay, and or the nurses when they are administering. So here I can share a few of my real life experiences where I came across some errors when I received the prescriptions from the doctors, and how we have rectified those things. So one day when I was working in the hospital, we had a patient who had the severe heart failure as well as the atrial fibrillation, cardiac arrhythmias problem. So for that patient, the doctor they started him on digoxin, one of the high risk medication. So they gave the loading dose of digoxin. The plan was to give the loading dose, that is the high dose of 250 micrograms twice daily for 24 hours, and then switch over to normal dose. Okay, that is ongoing, like 125 micrograms oral tablet, and then discharge the patient. Okay. So after 24 hours, when the patient was getting discharged, again, they gave the prescription of the same loading dose strength, that is 250 micrograms twice a day. It was a major error. Okay, so if we have sent that prescription if we have discharged that patient with that same dose that is mentioned, and if the patient start using that dose, then it would be a big major harm to the patient. Okay, so that's the one of the examples. And also many times I came across medications where the doctors, they have prescribed the wrong strength. For example, for one of the patient, they have prescribed the methadone. Instead of mentioning as 25 milligram, they mentioned as 25 ml. Okay, so which becomes a major error up over there, where the patient, if they receive the 25 ml, okay, then it will be a very high dose to the patient. Okay. So such a type of the incidences that happened, even with certain high-risk medication, other high-risk medications like with the warfarin, like the doses errors that came across. So the thing is that as a healthcare professionals, okay, so while we are working as a pharmacist, means we are taking the complete responsibility. Okay, so we are responsible for patients' health. We are responsible, and by being a pharmacist, we take the oath that patients' health and well-being is the first priority that the healthcare professionals that we give. Okay, so the pharmacist, the main first priority is they must give the patient's health and well-being. So which means that to make sure that the patient's health and well-being is maintained, a pharmacist must make sure that they have to check the prescriptions whenever the doctors, they write the prescription. Sometimes errors might happen. Okay, so it is quite common. Okay, so because all are human beings, so errors are quite common. So that's why the system in all these countries is always in the dispensary a pharmacist must be available, and the pharmacist must check each and everything. Okay, and the pharmacist must hand over the medication to the patient, not any dispensary technician or not someone else. A pharmacist must hand over the medication to the patient, and a pharmacist must provide appropriate counseling that how they have to use this medication. In case if it is a new medication, then the pharmacist has to counsel the patients. So this is how the healthcare system that is in, whether we take in Australia, New Zealand, Canada, US, UK, Ireland, wherever it is, whatever the country it is, okay, all over the world. So this is the rule that has been implemented by the pharmacy board of all these countries. Okay, so if in case as we are taking the responsibility, so which means that we must be much cautious. Okay, so either we are at the intern level or we are at the pharmacist level. So when we become a pharmacist, means we must be more careful, we must be more cautious, because all the responsibility will be on the shoulders of a fully licensed pharmacist. Okay, so a pharmacist must be much careful. They have to double check, okay, before they hand over the medications, and especially for high risk medications, whatever the list that I have mentioned. So for such medications, they must keep on checking 2 times or 3 times. It doesn't matter. Even sometimes the patients, they might be whoever they are waiting, so they might keep on ailing and keep on saying that we are getting late, we need the medication as soon as possible. So we should not, a pharmacist should not come in the pressure and should not commit any sort of the errors. Okay? So this is what that by being a healthcare professional, a pharmacist should take the complete responsibility and work at the workplace.
Sir, as you rightly mentioned that being a pharmacist takes oath that the ultimate thing is patient's health, right? And for that, they
Exactly.
must go through multiple checks. And be it doctor, be it pharmacist, be it fellow intern pharmacist, everyone should check it 3 times or 4 times or 5 times, whatever it takes. And thank you for your wonderful insights, sir. Now I would like to take your closing remarks on this incident and how this should not occur again, and what would you like to tell those who are getting into this field, who are willing to learn, who are just understanding about these scenarios, how a pharmacist function, what are the expectations from a pharmacist, and how they are expected to perform their duties? Sir, your closing remarks.
Well, of course, when we become a pharmacist. Okay, let's start with the intern level. Okay, so even an intern pharmacist means soon, within a few months, so they are going to become a fully licensed pharmacist. So even when they are at the intern level, so they should be much cautious. Okay, so at the workplace we must be much cautious. We must keep on checking each and everything. Okay, especially when the doctors they send the prescription, so we have to cross check, we have to double check, and whenever we are not confident enough to dispense that medication, then we should not handle such type of the things. Okay, so this is the most important thing that I would like to tell any intern or any, even the pharmacist. Sometimes they may come across some new medications, okay, that they have never dispensed or never handled those medications. So when they haven't done, or when they haven't dispensed such type of the new things, then they should, they should not do some sort of experiments up over there. Okay, so they have to wait, they have to consult the senior pharmacist who is over there. Okay, or have to contact the pharmacy manager, okay, and get the inputs from there. Or if they are not much confident enough, they can also contact to some other resources, or they have to check the resources. They have to, in all the pharmacies we have the online resources that are available. At first we have to read everything, we have to check the resources, and then we have to dispense the medications. Okay, so this is the main thing that all the pharmacists that they have to do. And the other thing is that when it comes to the workforce, like, I know that because even I have worked before I moved to the hospital. I have worked in community pharmacies for around 1 year. That is during my internship, and even after internship for a few months, I worked in the community pharmacy. So, which means that I know how busy the community pharmacists will be there, and how the chances of the errors will be in such places. So, the only thing is that I would like to tell you is, as of course sometimes we will have overwhelming workload. Okay, so where we have to dispense like more than 20 prescriptions will be waiting there in the waiting basket, and we have to clear all the prescriptions, and the patients will be waiting there at the counseling, at the script out for counseling, so on. So such things will happen, okay, in the real life practice. But by being a healthcare professional, we should never try to rush and try to finish all the tasks. Okay, so we have to talk to the, in case if we are getting more workload, overwhelming, if they feel that the work is more overwhelming, then they have to talk to the manager, and they have to clearly explain that, so this is the situation that is happening in the pharmacy, and I need more support. Okay, so one more hand, especially during the peak times, peak hours. Okay, so I need one more hand helping in the pharmacy. So this is how that we have to discuss with the pharmacy owners or the pharmacy managers or the supervising or the in charge pharmacist, whoever they are on the day. So we have to discuss, because as a intern or as a pharmacist, we have our own autonomy to express our concerns. So we have to tell them, we have to express everything, and we have to tell them, and to make sure that such type of the errors won't occur, and we must prevent such type of the errors. And also finally, one common thing that I would like to, one main advice that I would like to give to the intern pharmacist is, so everyone, those who enroll as an intern pharmacist, you make sure that you have to get the professional indemnity insurance. So without having the insurance, you should not practice. So this is the another important thing. So all the pharmacists should maintain the annual insurance, and even the interns, they also have to maintain the annual insurance. Okay, so which is one of the mandatory things. And yeah, so these are the few things that as an intern or as a pharmacist that we have to follow, and we have to do our best to justify our profession.
Yeah, sir, rightly said. Thank you for your wonderful insights. I hoping that your insights will definitely get into the ears of newly entrant pharmacists who have just started their career, and they will get a new hope of how they can see through their career and work as a professional pharmacist. Thank you so much, sir, for this wonderful interview. Thank you.
Thank you so much, Ashutosh. Thank you.